Well, welcome everyone to the 2024 NIC Spring Conference. Delighted to have you here with us. We've got an exciting couple of days of programming as well as meetings and networking for all of you. I'm Bob Kramer, co-founder, longtime CEO, and now strategic advisor and board member at NIC, and I'm so delighted that you're here. Our focus of this conference is care and housing for older adults. That might seem like nothing new or novel for NIC, but that frame of thinking about care and housing is a different frame. It's a broader frame. We're thinking about care and housing, and when we do that, we mean more than just simply assistance with activities of daily living or instrumental activities of daily living. What we mean is thinking about management of chronic diseases. What we mean is taking increasing responsibility for the people living in our communities, for their complete health and their longevity. And that broader focus then opens up the need and the opportunity for partners as we address the complete health and longevity opportunities and needs of our residents. And we're going to be talking about that in both main stage sessions and in our innovation labs today, tomorrow, and Thursday morning. So we also, we have a theme of turning insights to action, and that couldn't be given that theme, it couldn't be more appropriate than to start with a panel from NIC Research and Analytics focusing on demonstrating the value of senior housing and care. NIC has been a long-time thought leader in the senior housing and care space. And past year's been no exception. We've had a lot of groundbreaking research. One particular study, which you're going to hear the results that have just been released as of this morning, and you'll be the first public audience to hear about them. And we're very excited, and we think, quite frankly, though I know all the meetings going on now are incredibly important, some of the results you're going to hear, every investor and every operator of senior living should be jumping up and down about them and excited, and ought to be here and understanding what they mean for their business strategy and for how they communicate to particularly to prospective residents and to their families. But before we go into that, we've got another special announcement. During last year's spring conference, we had a data town hall. The feedback we received was that creating a standard chart of accounts was the highest priority for the industry. NIC, as a result, created a small task force to develop this proposed standard chart of accounts. Joining me now on stage are Colleen Blumenthal, COO and partner of Health Trust, Eric Morton, CEO of NIC Map Vision, and Sebastian Brown, Managing Director at RSF Partners, to provide you with an update. Colleen?
Thanks, Bob. Hi, everyone. I'm Colleen Blumenthal. I am COO of Health Trust, and we're going to figure out where we're standing.
Yeah, sorry, Colleen.
So we're here to tell you what we've done since the last spring NIC, specifically with regard to this initiative to create a standard chart of accounts. After the last town hall meeting, a group of us, including Eric Morton with me here, and eventually Sebastian Brown as well, we were joined by Ray Braun of NIC, Kathy Reiser of Freddie Mac, Brandon Williams of Fannie Mae, Eric Morton with NIC Map Vision, and me, to try and develop a chart of accounts so we can all agree on what we mean when we use certain terms. We spent months working on developing a template, and then we broadened the tent to include other people to look at it as well, including Carrie Hansen of Ventas, Wendy Russ of LCS, Ann Hampton at Wells Fargo, Don Cuso of Brookdale, Swagat Banerjee at Welltower, Sebastian Brown to my left, Wayne Harris at HUD, Kathy Sweeney at Blue Moon Capital, and Ray Elliott at Yardi. One of the things that we gleaned from those discussions was that we're really not talking about a standard chart of accounts, but rather standard reporting. And so what we want to do is not force operators or lenders or anyone to adopt specific accounts and change their accounting, but rather agree on how we're reporting those results. And I'm going to turn it over to Eric now to talk about how we're going to make your life easier to adopt this initiative.
Thank you so much, Colleen. Our enhanced process for converting any income statement to the standard financial report will significantly streamline financial analysis and reporting in the senior housing industry. By simply uploading an Excel file to a dedicated portal, users can instantly convert their income statements into a standardized format. This not only ensures privacy and data security through anonymous processing and zero data retention, but also allows stakeholders to easily edit mappings and perform detailed analyses. So it's simply a matter of uploading an income statement, it will automatically map those accounts to the standard financial report, and then provide a very easy tabular output to kind of correct any mappings, and then it will literally put it right out into a template that will effectively have mapped those standard financial reporting accounts. So the immediate availability of standardized financial information facilitates better investment decisions, enhances transparency, and promotes sector-wide consistency, making it easier for investors and operators to compare financial performance and make informed strategic decisions. And that's really core to what we do every day. So now I'll turn it over to Sebastian Brown.
Thank you, Eric. I hope you have a lot of gratitude for what this task force is taking on. I think we've all identified that this is a major need for us. Increasing the transparency from not only the operations of what our properties do will help efficiencies in underwriting and financial reporting. That should attract more debt and equity capital, which is one of the goals of NIC here. So these transparencies will certainly help in those efforts. I think this is an absolute game changer if we can get this done and accomplished, and I'm just really hoping that we can move ourselves and transform ourselves, kind of similar to what the lodging industry has done in the past. So after years of talking about it, we're finally on the front door of this, and I just really want to congratulate Kathy and the task force for getting this time and position.
Thank you. Thank you all. Thanks, Colleen and Eric and Sebastian. I also want to mention that he couldn't get here in time, but Justin Hutchins, EVP of Seniors Housing and NIC board member, was also going to be up on stage with them for this. I hope that you all have noted, perhaps we went through it too quickly, but participating in this were Fannie, Freddie, HUD, Welltower, Ventas, Wells Fargo, Brookdale, Life Care Services, RSF Partners, Blue Moon Capital, Health Trust, Yardi. So in other words, we got a lot of significant players in the industry, and particularly a lot of significant players that have to look at a lot of financial statements. So again, this is not asking anyone to change their accounting software, but it is saying we need standard financial reporting. We at times can pat ourselves on the back as an industry saying, oh, look at what we've accomplished with NICMAP and now NICMAP Vision. And we provide the same transparency that investors have in other commercial property types and in other asset classes. Well, folks, we don't. That's not true. And one of the areas we don't have it is we don't have standard financial reporting. So another sign of the industry maturing is the industry having a standard financial reporting. And so I want to commend the task force, commend all the volunteers who've put in a ton of hours. But these are the kinds of things that are critical for this industry as we've now moved from sort of niche alternative asset to main stage. And if we want to be seen as a major commercial property type, this is the sort of thing we've got to be providing. So again, thank you to that task force. I'd now like to introduce, to moderate our session today on demonstrating the value of seniors housing and care, NIC research and analytics, Jim Thompson. Jim is SVP at Flagstar Bank, formerly Signature Bank, and he is the senior credit officer for Flagstar's new healthcare lending vertical. He'll be moderating this panel. He comes to this role with more than 30 years experience in seniors housing and healthcare. Prior to Flagstar, he was director of senior housing and investments at BOK Financial. Prior to that, long stints with Synovus and with Capmark. Just as important for his being up on this stage today is that he may have 30 years in healthcare and senior housing lending. He's got 15 years as an NIC volunteer. and always willing to step up and volunteer his time in order to advance the industry. He just, until recently, was a chair for this spring conference. And so we owe a great deal of gratitude, and the industry does, to Jim for his commitment to the whole sector, as well as to NIC. So with that, I'd like to take my seat and turn it over to the moderator, Jim Thompson.
Thank you, Bob. And I'd like to add my welcome to all of you to the 2024 NIC Spring Conference. The conference theme this year is Insights into Action, and as a result, I think starting off with this research panel is entirely appropriate. And later on, I'll run through a few sessions that'll be happening tomorrow that will follow on a lot of the themes that you're going to hear about today. I'm pleased to have a remarkable group of experts to discuss key findings from various NIC-sponsored research activities. Directly to my left is Lisa McCracken, NIC's Head of Research and Analytics. Next to her, Dianne Munevar. Dianne is Vice President of Healthcare Strategy at NORC at the University of Chicago. Bob needs no introduction. And at the end is Diane Ty, and Diane is a Managing Director of the Milken Institute's Future of Aging, so an august group to be speaking in front of you today. You will hear about recent, in some cases very recent, and ongoing research conducted by NIC's leaders and their research partners. For example, results from NORC on health and longevity in seniors housing provide evidence-based support for what those of us who have been involved in senior housing for many years know, really only anecdotally to this point, is that a resident's well-being is enhanced and they live longer following a move to seniors housing. And this is compared to their non-congregate peers out in the community at large. And this is certainly contrary to the common perception that followed COVID and followed recent media reports that assisted living is somehow dangerous and that it doesn't provide the value promised for its cost. Harvard's research, and Bob has graciously agreed to pinch hit our representative from Harvard was unavailable to travel today. Thank you, Bob. But this research looked at the dual burden of housing and care to assess affordability of both home care and assisted living. Although they're equally unaffordable for the middle market, the research indicates that home health is not the obvious solution. And while this study has important implications for the cost of in-home care compared to assisted living, it also highlights the fact that the middle market older adult cohort, I got through that, that this cohort is seriously underserved. And with our aging population facing us, many affordable housing and care alternatives will need to be developed with our help. And you'll hear more about this from Bob, about this important research. The Milken research, the reason that Diane is sitting way over there, Diane, is that the Milken research is moving us towards solutions to the most common barriers that really prevent us from scaling middle market and care options for seniors. By taking advantage of the current market dislocation and the opportunity it provides to repurpose older buildings and whose values are currently being set, as I'm sure many of you in this room know, and by developing partnerships to pay for the care needs of those in the middle market, I think we can expand middle market options in a meaningful way. And Diane Ty will elaborate further on 4 such proposals. But let's start the discussion with an overview from NIC's Research and Analytics, their activities, goals, and objectives from Lisa McCracken. Lisa?
Thank you, Jim. Thank you. Appreciate all of you joining us here this afternoon. So excited to share with you, what our team has been up to and recent activities. And then before we wrap up here today, we'll talk about what lies ahead on the research horizon. But I want to make sure you know I think we just lost the slide deck, our team. So we do have a NIC Research and Analytics team who you will see throughout there they are. So they are here. Please make sure you introduce yourself, and we always welcome feedback, questions about what research and items that we're working on. So we have a hardworking group of individuals, and we're proud to bring you some actionable insights, given the theme that we're talking about here this week, and some really meaningful data and information for you. Behind that group, we also have a newly formed research committee. This group actually kicked off yesterday formally. So we've put together an infrastructure where we as a team obviously are always scanning the market and paying attention and receiving feedback from groups like the board and other volunteers. But we wanted to be able to set out a research plan that really was driven by thought leaders in the industry. So MJ Ritchell with Kisco, you can see there is our chair for this committee. I'm really excited to work with this group of individuals over the next few years to make sure we're bringing you meaningful information that is going to have the greatest impact and bring you the greatest value. So I'm going to just quickly define what research means to us. This is pretty broad. Our team works on a variety of different things from research reports to case studies. And as part of that, we see our role as packaging that information in a meaningful way. So we obviously put together written pieces for you to access. I will tell you one of the best ways to stay on top of the research that we are conducting is to get our NIC Insider newsletter. You can easily sign up for that. That goes out every 2 weeks and is chock full of really great information. But we want to package that and feed that back out to you in sessions like today, through webinars, podcasts. We often will facilitate roundtable conversations, and those are often conversations where we are taking away just as much as hopefully what we're contributing. It's important that we have our ears to the ground as well. Surveys, so NIC polling, all of you checked into the conference this week, and you saw that we were getting some data collection underway as part of that, and we'll be sharing the results of the question that all of you answered around the outlook for senior housing and care. And then articles and thought leadership are a part of that. So that's really how we define research. And NIC's core business is what we've been founded on with the NIC MAP database and NIC MAP vision data that we are constantly mining. But we are also pivoting to really make sure we're bringing you meaningful information and research around the NIC strategic plan. And so I'm just reminding all of you, some of you this may be new, but as part of the NIC strategic plan, there's 5 focus areas, and we've got committees that are forming around each of these that will bring forth suggestions to that research committee that you just saw. So that includes partnering for health, which is a lot of the conversations that are taking place here at the conference. The middle market, which we've been committed to for a long period of time. We've got a lot of work to still do on that front. Active adult, so that's that active adult rental market that continues to emerge and to grow. Capital for operations, so how do we financially support and capitalize the operators out there that are ever increasingly important from a consistent management standpoint. And then age tech. So there's a lot to unbundle there, but you'll continue to see research unfold from our team around these focus areas. So I'm just going to highlight a few, and then I'm going to tee up some exciting news with some new research coming from NORC. So we've been excited over the last roughly 6 months to bring you some case studies. I strongly encourage you to check these out. Pretty easy to find on our website. And what we've aimed to do here is not just bring to you some nice write-ups of some great best practices, but some meaningful information around metrics and data where you could potentially replicate, scale some of these topic areas, and really learn from the peers that we've been highlighting. And I will tell you, hats off to the individuals and organizations that we've been profiling. They've been very transparent, and we appreciate that. So we've had some new middle market, active adult. We've had some around partnering for health this past fall and some on the horizon as well. I mentioned the NIC polling at the conference. Our analytics team is always busy really trying to slice and dice and dive deeper into the analytical work. We've done some recent work on construction analyses, lender survey, so what are the lending trends in this space and what's the volume look like, and tracking some of that information. Occupancy, so where are we on that recovery trajectory coming out of the pandemic lows, and really trying to bring you meaningful information. That's one of those areas, what can be helpful for you to learn more about and give us that feedback. And then, again, we had some successful webinars. Many of you participated February 1st. We focused on the middle market, and some of that was releasing some of the information with our sponsored research partners, but we had nearly 1,000 individuals register for that, followed by an Accessing Capital webinar on February 13th, where we had nearly 800 people register for that one. So we're proud of the information. We know it can be a lot. We will produce a year in review, a report at the end of the year for all of you. So, and again, I'll be coming back here at the end talking about what lies ahead.
Thank you, Lisa. Diane, would you give us an update on NORC's research, including yesterday's announcement or today's announcement?
Yes, absolutely.
Thank you.
Hi, everyone. I'm Dianne Munevar. As Jim mentioned, I'm a vice president in the Healthcare Strategy Group at NORC at the University of Chicago. That's quite a mouthful. I'm excited to share about the research. So as many of you know, or maybe all of you know, NIC and NORC have been collaborating for years on research. We've done some middle market work, and then just over the past 6, 7, maybe 8 months, we've been working on this 4-part research portfolio that looked at, or is looking at, the vulnerability of older adults. That moment before move-in is a very critical one for people. So what do their lives look like after they've moved in? And so we did some work on looking at how frailty changes after move-in. We also looked at access to physicians. Now we're looking at longevity, and then we'll be looking at health outcomes. But these are all cumulative reports. We are learning a little bit more as we go. So this is the 3rd of 4th, but you'll hear a lot about outcomes as I talk today, and I'm happy to answer other questions a little bit later. So today's report that just released earlier this afternoon, the research builds a holistic picture of longevity for older adults who recently moved into senior housing communities. That is really important for me to kind of unpack here. There's 2 pieces that I want to unpack. What does longevity mean? Longevity is not only adding years to life, but is it also adding life to years? And so we have outcomes that are looking at mortality and how many days people lived, and then we have outcomes looking at days away and preventative and rehabilitative health services. The other piece I want to unpack is thinking about those individuals who've recently moved in. As I mentioned, that year before move-in is a really critical, sensitive time for people. Things are happening in their lives, they are experiencing acute events, and they make the decision to move into senior housing. And so in those first 3 to 6 to 9 months following move-in, it's a critical time. And so what we wanted to look at is what can senior housing properties do to mitigate the risk of experiencing more adverse events? So that was the basis of this study. So with mortality, we looked at the risk of dying during the study period. It was a 2-year period that lasted from 2017 to 2019. That kept us free of COVID because there was never an event like COVID. So we really wanted to isolate to understand what is the impact of senior housing in a COVID-free period of time. Then we looked at days alive. Again, this is of the 2 years, how long did people live in that 2 years? Ideally, 730 days. So we looked at, of the 730 days, how long did people live? Then we looked at days away. Again, this goes back to, are we adding life to years? And so you can extend life, but is the quality of that life worth it? And so we looked at days spent in a hospital, a skilled nursing facility, or on antipsychotic medications. Then we looked at, well, what's happening within the building? Are they getting access to more preventative and rehabilitative health services? And so I'm excited to show you a little bit about what we found. So in summary, and then I will get a little bit more detailed in a moment, the study tracks longevity outcomes for these individuals. Older adults who live in senior housing live longer than those who do not. I just want to pause there and say that. People who moved into senior housing communities were matched to people who live in their same 9-digit zip code, matched on a whole list of characteristics that I will not bore you with right now. But when they were matched, those individuals that moved into senior housing lived longer than their matched community dwelling peers. Number 2, senior housing communities outperformed other settings in managing residents' antipsychotic medications. Older adults who live in senior housing are more likely to receive care, preventative services. So these are E&M visits, evaluation and management services. So that's physician visits, it's PT, OT, SLP, and home health. And so we also looked at variation across the industry and across the property types, within the property types. And what we found was that there is quite a bit of variation. When we looked at quartiles, we found that the top 25% of properties have better longevity for their residents than the lower 25%. So I'm going to get into a bit of the details now. Senior housing residents have a lower mortality rate, as I mentioned earlier, in those 2 years after move-in than peers in the community. So they are living 2 percentage points, not percent, but 2 percentage points longer than their community dwelling peers. And again, there's quite a bit of variation when we look at the top 25% and the bottom 25%. Senior housing residents live longer. So of those 730 days, they are living longer than their peers, on average by more than 10 days. Again, if you look at the variation, you're going to see very wide variation across the industry and by property type. And why are they living longer? Because they have more access to healthcare services. So they're getting more rehab, they're getting more preventative. And all of these things are helping them reduce their frailty, reduce their vulnerability to adverse events. And eventually what they're doing is giving people a higher quality of life when they're in senior housing. So they are receiving, on average, 8 days more while they're in their senior community. So with that, I thank you. I'll hand it back.
Okay. No, I'm not Jim Molinsky. I wish she were here. She directs the Housing for Older Adults program at Harvard at the Joint Center for Housing Studies. Unfortunately, she became ill, so I agreed to pinch hit. I'm sure I won't do as good a job as Jen, but hopefully be able to, also from NIC's perspective, to talk to you a little bit about some of the significance of our findings in this report. This is the 2023 Joint Center for Housing Studies Housing for Older Adults report. And it's really almost like a data book. And there's just a ton of data there, demographic data, financial data, housing trends. With NIC's support, they did a particular deep dive on the issue of the middle market and how well the middle market is served. And the second thing is they introduced a concept for the first time ever in major mainstream research looking at housing and particularly housing for older adults, of the concept of the dual burden for both housing and care, and looking at those together rather than sort of separate studies. And I think this was probably one of the most significant contributions of this study. But just a few data points in just a couple of moments, and you see here on this slide. Overall, we've got, as you see, over 11 million, or a third of all older households headed by someone 65 or over, are what are called housing burden. That means 30% or more of their income is going for housing. Now, yes, you would expect that that's particularly true amongst those that are considered low income. But what was surprising to the researchers at Harvard, not surprising to us, having done the Forgotten Middle study, was how much that housing burden had crept up into, quote, the middle income. For instance, of those with incomes of $45,000 to $75,000, over 40% were carrying mortgages, and of those, over a third, over 35%, were cost burdened by that mortgage that they were carrying. Another thing, another sort of finding, was that older homeowners are much more likely to be carrying debt later in life than in the past, and much more debt than later in the past. For instance, the share of homeowners age 80 and over with housing debt was only 3% in '89. In 2022, it was 31%, almost 1/3. The share of homeowners 65 to 79 with mortgage debt went from 24% in '89 to 41% in 2022. And the amount of that debt, also in real dollars, has skyrocketed as well. Another thing we saw was, particularly in the 50 to 65 cohort, we saw a decline in home ownership. So all of this is important because much of the Harvard study looked at just income, but then with the assumption that people would sort of use, for instance, home equity to be able to, the equity from their home to be able to afford, whether it was assisted living or whether or not it was home care. And this growing debt burden of this age group and decline in home ownership amongst those in the 50 to 65 is significant as we think about the future. So another key trend that we saw is it has to do with accessibility. This number has been out there before, but I was so glad to see it highlighted in this report. Less than 4% of all U.S. housing stock has the three, what are called or considered the three basic features of accessibility. What are they? Zero step, no step entry. Secondly, the ability to have single floor living. And thirdly, wide doorways and hallways. Those are considered sort of the three basics in terms of accessible housing. Less than 4% of all current U.S. housing stock fits that bill. And you know, when you look at that then, and you look at with the first boomer turning 80 in 2026, and you look at the reality of people having mobility challenges, and so very little of our housing stock has those three basic requirements in terms of accessibility. So, and then on this slide, the last two things here on the right that I want to talk about have to do with this dual burden. As I said, a key concept, and having been on a number of calls with housing advocates as we worked on this study, I can say that for many of them, this was the first time of encountering this concept and the first time of kind of thinking about the burden of care. And then the default mode was, well, I'll just stay home because it's cheaper. I can't afford private pay senior living. And so you see here that, for instance, only 13%, yes, could afford assisted living. And again, this was looking at, there were a number of things that were part of this in terms of looked at the base price of assisted living, average set of out-of-pocket health costs, and other miscellaneous costs of living. But only 13% of this group could afford assisted living on their income alone. But when you then looked at home care, only 14% could afford 4 hours a day, usually the minimum increment that you have to purchase. 4 hours a day of home care, only 14. So basically, very little difference for both. They were, for the most part, unaffordable. Now, this again is based just on income. So, you know, I think then, and by the way, that with the cost of affording it at home, we looked at regional median costs for personal home health aides, housing costs, out-of-pocket medical costs, food, and other costs. So that's how they came up with that 14%. And this was the idea of a day, one visit a day, 7 days a week for 4 hours. One of the things this reveals, of course, is how much our system, even though it isn't really a system of long-term care, has always relied upon the family being there to supply that care when a caregiver isn't there, a paid caregiver. So now if we go to the next slide, the Harvard study next zeroed in some, and they did what they called a gaps analysis, or they had their gap group. Now again, this is because the research was a little different from some of the prior research, for instance, we'd done with NORC at the University of Chicago. And so in their gaps analysis, it was between those that they thought were eligible for either housing subsidies or long-term care support, meaning through Medicaid, but could not afford in the markets where they lived the average price of assisted living in that market. And then they specifically looked at 97 or almost 100 major metro markets in doing this analysis. And so it was people who, and in this GAPS group, they had 50% or greater income in terms of the AMI, the average median income in their area, but they did not have enough income to be able to afford the cost of assisted living in their market. Now, what did they find? They found that in this GAPS analysis, this GAP group comprised about 30% or 29% of single person. Again, in our analysis, we had looked more broadly. They just looked at single person households, households headed by someone 75 or older, but it was a single person household. And the fascinating thing was they looked at this by metro market. So again, what were the findings there? The findings were that, the share of people in this GAPS analysis varied significantly from market to market. As you see there, it was 15% in Los Angeles, but 48% in Dayton, Ohio. And so it didn't have to do with the cost necessarily of living in that metro area. In terms of the lack of affordability, if you want to put it that way. So for instance, in the high-cost Bridgeport metro area in Connecticut and the lower-cost Lakeland, Florida metro area, GAPS households in our studies would both need about 2 times their income to afford assisted living. If you're interested, and by the way, I would assume every market feasibility consultant and every company that's thinking about expansion or what communities they're going to acquire, and every investor that's thinking about acquiring, if you're not looking at this metro analysis, you're failing to do the due diligence, and you ain't doing your fiduciary responsibility. Forgive me, but you're not. So what does it show? Where there are 6 metros in the GAPS group that are closest to affording the median price assisted living in their area, and you might be surprised. Well, there are 2 in Utah, Salt Lake and Ogden, but 4 in California, San Jose, San Francisco, San Diego, and LA. Not those you would traditionally think of low-income markets, but that's where the GAPS group is closest to being able to afford. Those in the GAPS group where there's the largest divide, they're the furthest away from affording assisted living, include metros in Pennsylvania, Ohio, Michigan, and North Carolina. So again, now, also, lest one think that the solution is care at home, for this GAPS group, only 8% could afford a 4-hour visit a day from a home health aide. And if you're thinking adult day is the answer, less than 40% could afford to participate in an adult day program where they traveled to the adult day program. So again, I think all of this says, as we'll get to really with Diane Ty's comments and with regard to the Milken study, we have an enormous challenge and an enormous opportunity to serve this group. The Harvard study speaks to the dual burden. It speaks to staying at home as an option is not really an option. It's just avoidance of the problem until the crisis hits. And lastly, the variability by metro market is significant and has implications for everyone attending this conference. With that, I want to turn it over to Diane Ty, the director of the Center for the Future of Aging at Milken Institute, with whom NIC has been so pleased to partner.
Thank you so much, Bob. And if we just want to pull up the slide. So for those of you who may not be familiar with the Milken Institute, we're a global, nonprofit, nonpartisan think tank that's focused on accelerating measurable progress on the path toward meaningful life. And I remember last year at this time, still new to my job, NIC leadership kept referring to this project that was underway at the Milken Institute, and every time I heard that, my heart would race. And so it's really nice to be on the other end of it, having completed the work and being able to present the recommendations to you today. So we were all about trying to identify innovative financing solutions for this very problem of really trying to afford for the middle market consumer with senior housing and care. The barriers, I think, are well known by this group. So we did what we call our Financial Innovations Lab. It's a trademarked process within the Milken Institute. It's kind of a mini think tank as we try to tackle this issue, led by two parts of the organization, the Center for the Future of Aging, which I lead, and our Center for Innovative Finance. And both the NIC and CVS Health were the sponsors. It was a year-long project. And it was informed, and I just want to walk through, because the process is very different in terms of this was a qualitative study, translational research, highly iterative, but we started with a landscaping. We did over 80 key opinion leader interviews, supplemented by desktop research. We convened a group of 40 people in Chicago for a day-long session back in July. We then synthesized, we organized 4 different working groups. This was all the information that came out of our forum, where we really dove into the barriers and came up with some promising opportunities and then tweaked them along the way. We had our Future of Health Summit in November, a panel on reimagining senior housing and care, featuring Lynn Katzman and Bob Kramer on our panel, both NIC board members. And then we released our report just this past January. We have had coverage in McKnight Senior Living, NPR's Phoenix affiliate, and we're expecting an article in Wall Street Journal, and then here today to highlight our findings. And I wanted to say, in terms of this research, we drew upon a brain trust, multidisciplinary, multi-sector. We really brought together operators, developers, investors, health systems, healthcare experts, technology experts, academia, philanthropy, and that's the approach we take, really trying to take this lens, this 360 lens on a really vexing problem like the middle market piece. So with the next slide, I'm going to just walk through what we came up with. This is the cover of our report, and I included the link there for any of you who want to download that. So 4 potential strategies emerged from our work, and just to note, they may or may not be mutually exclusive, collectively exhausted, NIC, to borrow a McKinsey term, but you may find yourself exploring some of these solutions or actually pulling elements from each of them to develop other types of solutions. So I'll walk through briefly the recommendations that came out, starting with the first one, repurposing distressed senior living properties, and really to come up with a pilot that refinances, restructures, rehabilitates some of these properties. So clearly, senior housing, was really hard hit in the wake of the pandemic. We know there's housing stock in need of upgrades, maintenance, at the same time, turbulent capital markets, increase in labor costs. And so the concern is that you're going to see more of these senior housing properties moving into real estate owned properties by lenders, who've tried to refinance, to sell, ultimately landing up in foreclosure. How can we bring together a group of experienced owners and operators to come together and say, let's cherry pick some of these and really demonstrate by refinancing and restructuring, we can actually turn these distressed properties into affordable, scalable, sustainable, healthy communities for the middle market. The second opportunity we identified was to design a revolving loan fund to provide sustainable source of capital for development, for acquisition, and for capital expenditures. And so this is a strategy that was really developed in response to the limited access to equity, limited or non-existent tax incentives, the lack of patient capital or sustainable capital. So the idea of a revolving loan fund that offers a type of concessionary funding. So as initial loans get repaid, those funds go back into the fund for new borrowers. And the thinking there was that either government funding or philanthropic funding could be that source that initially capitalizes this fund through program-specific, mission-specific type of investments or grants. The next opportunity we identified was to implement what we're calling a pay-for-performance model that really then recognizes the new revenue streams that can come about because we have senior housing providing the supportive care services for our chronically ill senior housing residents that are in that middle market. And so this is an opportunity, I think Diane really illustrated. If you're in the senior housing, you're living longer, you're getting the preventive and rehabilitative services, getting really good care. And so senior housing operators are absorbing that, they're delivering that, but they're not getting the benefit. Who's benefiting here? It's your insurers who are benefiting from lower claims. How do we share in that revenue? The fourth opportunity then that we identified is to launch a regional pilot between senior housing operators and payers as part of value-based care. So it was great to hear about the need for standardizing the chart of accounts, the financial reporting. We need standardization of data to show how the care that is being provided in the senior housing settings is actually resulting in better care, and really then having that data standardized across the board so we can demonstrate that value and actually participate in that value-based payment. So I'll stop there.
Great. Thank you, Diane.
Thanks.
I have a few follow-up questions for the panel, and I'd like to start with you, Diane.
Okay.
Has the Milken Institute seen any movement forward on the recommendations proposed in your report?
So I will say on the first one, we were talking about repurposing some of the distressed senior living properties. One of the things we like to talk about is at the Milken Institute of being a think tank, but also a do tank. So we looked at the recommendations. We were able to actually set up a meeting with our working group with the right person actually at Fannie Mae to say, is this feasible? You know, there's one thing to come up with the theory of how this might work, then you've got to really dig down and say, how does this really work? So we've had a couple meetings now with some executives at Fannie Mae. I know we're still making progress in terms of the working group, tweaking our thinking as we go along, but I know that work is continuing. And then the one on launching the pilot for the data standardization, we have some partners really interested in working with us on developing those standards and creating a multi-sector group, you know, that involves the technology players, the senior housing, the providers, the payers, and so we'll see where that goes.
Great. Thank you, Diane. And Diane, number 2, this question is for you. One of the natural reactions to the favorable results that you presented goes to translating these results into cost savings. Mm-hmm. Obviously, having fewer hospitalization saves dollars for payers and all of us, frankly. What are your thoughts on that and any additional value proposition on the part of senior housing providers?
Yeah, no, thank you so much, Jim, for that question. Yeah, I think the next step, the next analysis everybody would want, including us, to do is thinking about how do you translate the cost savings. And the translation is not just, you know, counting up the hospitalizations and, you know, determining what's the average cost of the hospitalization and just multiplying P's and Q's. It's really thinking about over the course of a year or 2 years, what is the total savings? And I think there's another nuance when we think about total savings, which is what does that look like for Medicare Advantage plans versus for fee-for-service? Mm-hmm. And then there's variability within the Medicare Advantage plans. And so I think that's kind of the next step, or like where we're thinking that there's some additional value proposition for the properties.
And you're talking about the fourth part of your group of studies, the outcome.
So the fourth part of our analysis is on health outcomes. So I talked a little bit about outcomes measures in longevity. And all 4 parts of this analysis really are about outcomes. I mean, starting from frailty, how do we reduce frailty or how do we improve frailty? That it's an outcome. It's all about outcomes and the quality of care. Then the second research was about access to physicians. Again, those are how do we improve outcomes? Well, we increase people's access to physicians and preventative care. This one, longevity, outcomes are mortality and living longer. That fourth study is now going to quantify those days away. What does that translate to? How many hospitalizations are saved in a year or in a 2-year period? How many ED visits are saved in a year or 2-year visit? How many skilled nursing facility stays and days are saved? And these are all factors, are all criteria that MA plans are thinking about when they are thinking about sharing risk. And so that fourth piece, which will come out in a few months, is really key to think about those valued partnerships with MA plans.
Terrific.
I would just add to that, Jim, that I think for many operators here in this room and their investors, the data that Diane shared may seem as, well, of course, we knew that. Well, we may have known it instinctively. We may have known it anecdotally. We may even, as an operator, knew that, gee, we were tracking a few things in our particular property. But the industry has never had a large data set analysis that actually took Medicare claims data and then demonstrated this with a comparable comparison group living in the community. That's never been done before. And so I just want to emphasize for us, if some of you are saying, well, I knew that all along, I want you to understand that, yes, but you didn't have the independent data to prove it. And without that, it's just self-serving when you claim it. And that's the significance of this, and will become even more significant as we go into the next steps. There are obviously huge implications of the fact that, gee, what is it about the top 25%, that top quartile? What are they doing that they are outperforming their peers as well as way outperforming living in the community? That's going to be really interesting. We don't know the answer to that right now.
And this
We
is
just
why
know on these measures they score much better.
This is why we need the data standardization. So we
Absolutely.
can collect this, so it's not just these individual, we know this is happening, but to
Yes.
do it at scale, to do it at scale.
Yes, the industry will definitely benefit from that, and I know whatever comes out of the outcome study is something that CMS, Medicare, they're going to want to know because they're the prime beneficiary.
Right.
Of these savings, and they need to know
Well,
participate.
Tomorrow morning we have the head of the Center for Medicare and the deputy director of CMS coming here. And one of the reasons she's coming here, this is her first time ever interacting with the private pay senior housing industry. This is it. This is the first time. She made a special effort to come out to this conference because she's hearing so many stories about partnerships and about what's going on in senior housing buildings. So that's huge. Well, having data for her, Dr. Seshamani, and her team that's based on their own claims data rather than just, well, I think my residents do much better living in my buildings. That's huge.
I think this reminds us too, just about our audiences and this messaging. So we've spent a lot of time talking about, obviously going through the results and analyzing them, but what's the best way to get this out? Obviously to all of you, as capital partners, as operators, but even in some conversations prior to us coming up here on stage is how do we get this out to the consumers as well? Particularly given some of the environment that we're in right now. This is really valuable information to really get out to multiple different stakeholders, and that's where I think all of you can play a role in helping us think through that as well.
Thank you, Lisa. And one last question for you, Diane Ty, to kind of put a bow around the solutions portion of our show today. How can interested industry leaders collaborate with Milken Institute to support executing the strategies that you outlined?
Yeah, so I think you've heard there's a sense of urgency, right, with the data that Bob shared, that John Molinsky did. We've known about this challenge for senior housing. It's going to we need partnerships, we need creativity, and we need to move fast. So, for anyone who might be interested, we've got these 4 different recommendations. 2, as I mentioned, 1 and 4 are moving forward. If you want to get involved, just reach out to me, and I can connect you into the right working group that's doing the work, or we're actually leading one of those as well. So we're happy to work with anyone who might be interested in jumping on board.
Terrific, terrific, thank you. And Lisa, would you spend a few minutes and give the audience an idea of kind of what's ahead in terms of NIC research and NIC-sponsored research.
Yeah, absolutely. So we're always trying to plan for, again, what's next, and part of that is a little bit of where's the puck going, and our research committee is going to help us with that. But additional sponsored research. So again, we're really excited for the release, and we'll release in partnership with NORC the outcomes research in conjunction with our data analytics conference in May. But all of this great research does generate additional questions. So we certainly anticipate a long runway ahead of us of bringing forth this esteemed third-party research. Our research and analytics team is going to continue to be busy. We've got some penetration rate analyses that we're going to be launching shortly in terms of trying to better understand what are some of the market forces that can really impact penetration. And if we could move the needle, even just 1 percentage point on penetration rate, given when we look at the demographics, that's pretty impactful. We are taking a look at the performance of our sector from a financial health standpoint. So we always track the occupancy and report on that and other market fundamentals. But working with some different partners and through some survey mechanisms that we have, taking a look at some of that distressed group and trying to break that down a little further. Within that capital for operations group that we reference as part of our strategic plan, we do have a task force that's helping us navigate through some comparative data as we look at the lodging and hotel sector, which from a maturity standpoint is a little further down the road than us, and what can we take away from their business model. So I think you'll see several different pieces come out from us on that. Active adult, I referenced earlier, we know that that's an emerging space, and whether you're coming at it from senior housing or multifamily. So we're going to be coming out with some additional updated white papers. We've done some work already on that front, so stay tuned on that. For those of you who tune in, and those of you who do not, we invite you for the NIC Map Vision subscribers at the quarterly data release. So we're taking a fresh look at what that webinar looks like and really trying to marry an update so you know what the latest fundamentals look like, again, from occupancy, absorption, inventory growth, those things, but bring some thought leadership. So we're bringing some new formats and some guest speakers, so we encourage you to watch us on that journey. And again, as always, we welcome feedback with that. Ongoing quantifying this value of senior housing, I think that's a big overarching goal of ours. And then we've been receiving for a long time many questions about our investment guide. So 2020 was the last time that NIC released that report. We've got our 7th edition of the investment guide that will come out later this year. We've got an active group of folks that are diving into bringing you a really great report. And September at the latest, maybe a little before that. So that's what lies ahead.
Great. And can you remind the audience where they can get detailed information about the studies and topics that we talked about?
Again, so it's, our website. By the way, we will have a new website coming out this spring, so you will definitely see communications on that. And it will be probably arguably a little easier to navigate and find some things that what we have today. But again, our insider newsletter is a great way to do that. If you go to nic.org, at the top there is a button that says subscribe, and you can just get that information that comes through every 2 weeks. And then we have different emails about, we'll be giving another shout out to the NORC study next week with some greater access to folks that weren't here today with us. So that's the best way to stay on top of things.
Thank you,
Jim,
Lisa.
can I
Yes.
add something on this understanding hotel management contracts? Because certainly capital for operations, a major strategic focus of NIC. And I was having a discussion last evening with Kai Shao of Keppel, and we were talking about then, hospitality management contracts in the 10 to 12% range. And then with a new community that they've just opened and in China with the management contract, okay, so they said, well, the floors we're providing hospitality. Most of us here would say that senior living provides hospitality. Then he said, well, on top of that, we're also coordinating and providing care. So on top of the 10 to 12%, we'll charge a 3% management fee for the care. So you end up with a 13 to 15% management fee, as opposed to 5% with a few
I hear loan covenants
incentives.
blowing all over.
Yeah. Anyway, I think the point is that as we think about capital for operations, And just as for years, NIC, I mean, we've at times hired different folks like Peter Linneman at Wharton and so forth to do an assessment of us and just compare us to multifamily and hotel.
Right.
And to say, all right, what can we learn from them? And do we provide comparable transparency? And as we grow up, and as we, for instance, have product diversification and segmentation, which the hotel industry has a ton of, and multifamily has a ton of. We haven't had much. But another thing to learn from is how they think about management firms and how they think about management contracts. And, you know, obviously the real estate has driven everything, but trying to get the value of the operator and the value of the operations is going to be key. So I thought, wow, wouldn't that be a novel approach? We'll take the hospitality and we'll take that, take that from the hospitality industry, and then we'll add care on top of that. And that'll be our management fee. A little different way than our industry's ever thought about it.
Sure, thank you.
Just to be provocative for a moment.
Right.
Well, but you're never provocative.
No, I'd shy away from that.
We do have a little bit of time for a couple of questions from the audience. I can't see any of you, so do we have anybody with a question for any of our panelists?
There, that helps. That's better.
Really blinding.
No?
Well, I hope you all will
we do?
avail
Okay.
yourself of some of this research. Particularly, I hope in the Harvard case, you'll look at those 97 metro markets and the analysis of that. I hope in the case of what Diane and her team at NORC have just released today, that you'll take a close look at that and really talk about that with your sales and marketing team, with your investors, with your operators. This is huge. Now, again, any good research in an early stage poses as many questions as it answers. And that's certainly true.
And speaking of questions, we have one from the audience, yes.
Can you guys share how much bigger the gap was? When we looked at mortality, there was a 2% improvement. How much bigger is it in that top quartile? And then how much bigger is the average days longer lived between the top quartile and the rest of the folks living in the community?
Yeah. So I should start by saying that the press release that went out has linked the final report. And so the final report, much longer than the slides here, there are property type level results. And so in the appendix, you can answer all of these questions, but I'll give you a sneak peek now. On mortality, overall, the difference is, so I'm going to just mention, I'm going to say this so that set expectations. The comparison group had a mortality rate of 22.4. The senior housing was 20.1. The range between the top 25 and the bottom 25, the top 25 was 11.1%, and the bottom was 27.3. So that's the range. Days alive. Days alive. Again, I'm going to say the comparison group was 644 days. The senior housing was 10 more than that, so let's call it 654. If you look between the top 25 and the bottom 25, it's a spread of 70 days. So 70 days longer, more than 2 months longer. Wow. Which I think is really important when you think about, when you're thinking about putting your mom or your grandmother or your father or your grandfather, your aunt, your uncle in a community. You're going to want to know, is it worth it? Are they extending life by more than a day? Is it 70 days? That's worth it. Mm-hmm. That means something. Mm.
Yeah. Let me add on this. It's also in the full report that you can get through the NORC and through our website, which links to it. We also have broken it down by property type. Yep. CCRC, independent living, and assisted living. We have some on freestanding memory care, but that's such a small sample that we're not putting a lot of weight on that, to be honest. But it's a very large sample for IL, AL, and CCRC. So we're doing it top quartile, bottom quartile overall, senior housing, all those property types, and then specifically by those three core property types.
Great. Do we have another question in the audience? No?
One thing I do want to comment on, so we talked about obviously from a consumer standpoint and choice and vetting, where your loved one lives and calls home. So, I think there's a benefit to understanding more on that front, but also I think collectively in this room, it's the old saying of a rising tide raises all ships.
Yeah.
So I think, and this is not a new thing, these findings really support some of the conversations that are out there these days around the variability of the experience. And I think we need to embrace that as an industry and say, what can we learn? And we're hopeful that additional research can help inform us. Are there some common characteristics of those that are consistently in that top quartile? And what can we learn from them? So we're hopeful that we can uncover a little bit more insights into that.
Terrific. Thank you, Lisa. And thank you, panel, for the insights today. And thank you, audience, for putting your geek on today.
So I'm going to take off my panelist hat and put on my host hat.
Okay.
And did you have a concluding comment you wanted
No,
to make, Jim?
I had mentioned early on that I wanted to mention several sessions on tomorrow's schedule that follow
Please,
themes.
go ahead.
So there are three sessions in particular. Navigating the middle market tomorrow at 11 a.m., data discovery tomorrow at 2:30 p.m., and then accessing public funds at 4 p.m. And Bob had mentioned earlier the main stage session at 9:30 in the morning features Meena Shishmani, the director of CMS in charge of Medicare, for a first ever visit. And I understand that she will be meeting with leaders within our industry to talk more about the value proposition in senior housing and care, and data is going to be an important element of that discussion.
Absolutely. Yeah. Thank you. Good. Thanks, Jim, and thanks, panelists. Please join me in thanking them. Just as we wrap up, a couple things I want to mention to you. At 4 o'clock today, we'll both have back here a main stage session. That will be on big retail healthcare strategies and the implications for senior housing and care. We've got a great panel, a chief medical officer at Kroger. You may ask, why are they up on the stage? Why are they here? We've got a medical director at One Medical, thank you. At One Medical, now part of Amazon. She was previously with Iora Health, that then became part of One Medical, and then Amazon acquired One Medical. And then a Chip Gabriel, a senior housing operator, and now involved in a partnership with Arnie Whitman in the Senior Living Transformation Center and what they're trying to do there. And then a really passionate geriatrician who is thinking in very innovative ways about how we provide complete health care for our population. So I hope you'll join us for that. There'll also be an innovation lab taking place at 4 o'clock today on orchestrating the future of Medicare and Medicaid for senior living operators. That's more of a hands-on session. That's at 4 to 5. And then after those sessions at 5 o'clock, we'll have our welcome reception. You see here a QR code that you can scan. We have a very simple, to help us we always want to improve our sessions. And you can't say you're all about data analytics and not do data for events like this. So you can scan that code, or as you go out, there are 2 kiosks on each side. It's a very short, take you about 5 seconds to do the survey. We'd love your feedback. So again, thank you very much for coming to this session. We'll resume here on the main stage at 4 o'clock. We'll also have the Innovation Lab next door. And thanks for joining us, and have a great 2024 NIC Spring Conference. Thank you.